Okay, it's done.
Hey, Anthony.
So we. Oh.
Hello.
Yeah, that's it. I think we are live. Can you see the chat of the YouTube chat? So we are live. I think you can start talk.
Okay. Excellent. I suppose I'll go ahead. So this stream, we wanted to talk about the aspect of the project where we have committed to produce things in an open source way. And this brings into consideration a number of questions, both on the side of what the problem is and what kind of solution we're pursuing that are interesting. So I think it's also interesting to look at all the ways that the existing infrastructure for producing medicines is not open source and the kinds of effects that that has and how that creates the situation that we're in and then what we're trying to do about it. So Louise and Jessica, you both have a lot of professional academic experience in labs where you're using proprietary equipment and proprietary strains and that sort of thing. So I thought it might be interesting to ask you, what kind of economy that is, how that affects the prices of things and what it would cost to do the kind of things that we're doing with producing a protein at a kind of small to intermediate scale. How that is affected by a lot of the infrastructure for that not being open source.
Hi, I'm Jessica McGrath. I'm a researcher at OpenInsulin, and I have about 15 years of experience working in industry producing small molecules and microbes. Yeah, so it's a tricky question because the more you make of something, generally the cheaper it becomes, but it also becomes single source. And so anytime you have a single source stream of something, the supply chain becomes vulnerable. And so this is kind of the situation you're seeing now where we're having shortages of test kit materials and other components because they're produced in a proprietary way by one company who can't keep up with the demand. Whereas if it was open source, you could have a lot more people producing it.
Okay, and that is referencing specifically the new plans we have that we're still developing them, but we're looking at using small scale protein production and purification technology similar to what we are using to develop insulin, and also using that kind of a technology base to produce spike proteins for coronavirus tests. So that's a little bit of interesting news in development right now in our group that hopefully we'll be able to share more about as those plans come along a bit further. So yeah, going back to what you were saying, so there's a brittleness in the supply chain that comes from just having one source of things or just a few sources. So we see that with insulin, and that there are only 3 companies that have any significant share in the global market for insulin, and that seems to give them a lot of market power. And people have noticed, for example, that they have increased their prices by just about the same increment at the same time for decades, and that is a pattern that has led up to the current situation where list prices are, an order of magnitude more than they were 20 years ago for state-of-the-art insulins. So, I guess there's another aspect to this, which is that when there's only one producer of things or only a few producers, and they're kind of in a closed market that doesn't subject them to a lot of competition, then the price gets really high. So I think this affects some of the consumables and equipment that we're trying to use as well. So I was wondering if you could comment on that.
Yeah, so there's actually been shortages of all sorts of things that are related to this and sort of the supply chain and the complexity of it. There's been some really interesting effects of the COVID on the supply chain. We're finding that CO2 is becoming in shorter supply, actually, because gas prices have fallen so far that ethanol producers are not using it to add to gas. So less CO2 is being produced because less ethanol is being produced. So the supply chain is really complicated, and you sort of see these ripple effects that come through, and you're having trouble getting very basic commodities in the lab right now. And so if you can make your supply chain more distributed and more involve more small scale producers, you can hopefully alleviate some of these problems that people are seeing in the supply chain.
Yeah, and speaking of supplies and reagents, there is a project with similar aims to our own that is aligned with Africa open source hardware, and they're looking at making producing enzymes that serve as basic reagents in bioengineering in on a technology base that would use small scale protein production and purification tools and techniques. So so that is definitely something that we as we develop the open source infrastructure for making proteins, that we would hope to start to be able to alleviate those supply chain issues. So with the equipment that is used specifically for producing and purifying proteins, like a bioreactor and a chromatography setup, considering just the core technological infrastructure that you need to do a lot of produce a lot of these things, do you have a sense of how inflated the price might be on these things? Like how large of a gap that we might be able to traverse and bridge, and kind of how far we might be able to bring these prices down, and how that might affect the accessibility of these to community labs and other groups like ours?
Yeah, so the equipment that is needed is often very, very, very expensive, and likely unnecessarily so. Especially, it seems like software is a big issue, but it seems like we can get the cost down at least tenfold by doing it open source, probably a lot more than that, depending on the piece of equipment. I think maybe, Anthony, you know a little bit more about the prices of these things, but it seems like some of the open source, like a bioreactor, if you buy it off the shelf, costs about $1 million. And we're thinking, I think, about 100,000 for a DIY.
Yeah, I think for a fairly large capacity one, we were looking at figures like that. And then for the smaller ones that we might be using earlier on in the process, it was like, $30,000 to $60,000 for a new one that had a capacity in the kind of 5 to 30 liter range, and we just started looking at what the bill of materials for this thing is, like just cataloging the pumps and the valves and the tubing and the vessel and stuff. And there it seems that you could get it down to similar price to like a DIY beer brewing setup, which involves a lot of those same components. It has like a vessel that can be sterilized, stainless steel or glass, and it has some pumps and some tubing and a temperature controller, oxygenation controller, stirrer, just things to maintain the conditions in the vessel in the correct range. And those sell for $3,000 to $5,000 already. So there's looking at the instruments themselves that we have, and we've also looked at how other projects that have done similar things have gone in the past, like OpenTrons, which made an open source pipette robot, and OpenPCR, which made an open source PCR machine, of course. And in each case, they were able to, slash zero off of the price of the proprietary device. So we have a question, apparently, from YouTube. Why has no one done it before? Speaking of creating open source biological equipment. Well, yeah, so people have done a couple pieces of equipment before, as I mentioned. And there is a kind of economy for very similar devices like brewing systems. So we're not, doing anything too new here, but it seems no one has got around to it before us, apparently. I do know that there were some groups in the Bay Area at, meetups that I went to a few years ago who were looking at making small scale bioreactors, and people in the field of personalized medicine have prototyped systems like this in an academic setting, kind of similar to what we're looking at doing, but even more smaller scale, where they would envision it being, a piece of equipment in an ambulance, or really small scale setup in a pharmacy, or sometimes in space, or whatever scenario they're looking at. And so people have developed those systems in an academic context as well. So we're just kind of looking at taking this kind of technology and applying it to this problem. And it seems that while we may be the first group to do that for insulin, there, as I mentioned, another group that's looking at doing that for enzymes, and we're looking at doing it for viral spike proteins now. So so there is a lot of work on this going on in general.
Yeah, and I think the developing world is another great place to look for these kinds of DIY, sort of scrappy innovations, where I think there's been people for a long time sort of cobbling together and making do. And so I think it's out there. It's just probably not as formalized. And so I think that's one thing that this community is doing, is bringing a very structured approach to it.
Yeah. And yeah, speaking of that, there's a number of projects that have come to our attention when we attended the Bio Summit conference over the past couple of years. One of them is that OpenEnzyme project that is being developed in conjunction with Africa Open Source Hardware. But they've also got within their network a number of other pieces of open source equipment, like a 3D printable microscope that is actually quite sophisticated, but like it gives you the capabilities of a pretty good optical microscope that you could spend several $100s or even a few $1,000s on a comparable microscope. but they've got it so that not only is it 3D printable, but you can actually like take it apart and put it in a suitcase flat and then reassemble it somewhere else. So really sophisticated designs that are, doing things that no commercial product has done before, like just fit in an envelope or something. Okay. Louise has a question apparently. Do you think industry and academia could go open source? What would be the challenges? Lobby or open source will mainly be used for community labs or startups? Yeah, I think, Jessica, you have a lot more experience on the industry and academia side. So I'll leave it to you.
Yeah. So I think while I would love to be optimistic and say that industry would go open source, I think there's absolutely no incentive for them to do that. If they create something, they're far more likely to patent it and keep it in-house and then possibly even sell it. Academia, I could see being part of the open source community. A lot of the labs are not as well funded, and I could see them being very interested in sort of making their own stuff, especially if you can do it in a very sophisticated way. Startups also may want to do it in the beginning, but again, I worry that if you get too much money involved, then you actually close the community down. That's for the hardware. I think for the biology, there's already a little bit of precedence in open source in academia. There's all sorts of repositories for different strains that most academics can get for free. So if you publish a paper, you're generally obliged to deposit the strain in a source that people can access it to reproduce your results. So you can think of that as sort of an open source community for strains within academia already. Yeah. I don't know if anyone else has anything to add.
Well, I am interested in what happened with open source in the world of computing and software specifically might inform what might happen in biotech. So in that area, you had a situation for decades where everything was proprietary and it required an enormous amount of capital to do things because everything was done on these, massive machines that would take up a whole building or a whole room. And I think that led to, well, the situation there was pretty similar to kind of what the incumbent understanding is in biotechnology now, which is that it's inherently expensive, and so it tends to result in monopolies arising just because of the amount of capital that you need to get into that business. But then people started developing ways of doing it at a small scale, and then that just changed the economics of things. And then you could, like in the mid 70s, you had people selling kits where you could build something in your garage, and then after that, 5 years, 10 years after that, it was just a mass produced commodity, and everyone could kind of work on this. Everyone had access to the tools, and then it just makes a lot more sense to do things open source after that. So I'm intrigued by that possibility because we are seeing the tools become a lot cheaper and more accessible, and we're working on some of that, and a lot of other people are working on that. And on the other side, there's some interesting economics work that I became aware of, which is actually came out of a researcher at the Minneapolis Fed who was looking at monopolies and government policies that favored monopolies and analyzing those situations, and concluded that monopolies destroy most of the economic value that could exist in the market in which they're operating, just because of the combination of really high prices and really restricted supply that they bring along. Like, they shut out almost everyone, and I think that could serve as a a framework within which we could view the insulin price and access crisis, which is that you have, in many ways in medicine and biotechnology, the government is promoting monopolies through mechanisms like patents and other aspects of how the policy and the regulation around it works, just as happened in these other cases that that researcher was looking at, like I believe sugar production and forestry and dentistry were some examples that he looked at, where there are these policies that favor concentration in supply, and then they have this disastrous economic impact down the line. And in medicine, economic impact is also health impact and lives lost, and it's not just money, it's actually human suffering. So there should be an even stronger argument there to try to avoid that problem, I think. So that's just an interesting idea, but it's one that we might be able to develop more rigorously if we start to look at that aspect of things seriously. Another question from Louise. Do you think open source can also be more ecological? If it's cheaper and more flexible, easier to repair, it could have a positive effect on the environment. Also, because it's cheaper, people can choose to spend money on more ecological material for some parts. Sure, I do. I did notice that, like when you 3D print your equipment, you can make it out of PLA or something that is biodegradable and that you can recycle easily. And I think there are signs that we're working at a smaller scale and integrating the production more closely along with the demand in terms of the scale it operates on. You can avoid a lot of waste that comes up in trying to produce things in huge batches and ship it over long distances. I know that is not a negligible problem in large-scale medicine, especially when it comes down to situations where the supply chain is brittle, where just the one path from the one source to the person who needs it is broken. But I think that can also affect, just things like tracking down a bad batch. That was an example that a group from Colorado State that wrote a paper about our project a couple years ago considered that scenario where it could actually be safer and more efficient to have small scale production, because when something goes wrong, if you produce a bad batch and it gets distributed or something, it's much simpler to find the people that it got to and recall it and replace it than it would be if there's just one factory that produced stuff for the entire world and you had to make sure to track every batch and make sure that you knew what country and what region and what pharmacy everything went to. It'd be a lot simpler if you just knew that it was produced in that pharmacy and exactly where it is from the start.
Yeah, so you can think of this almost like the food supply chain. Everyone knows that eating local and in season is better for the environment than having food shipped halfway across the world. So if you think of your medicine the same way, where if you only manufacture exactly what you need for the local population, you not only don't have waste and storage, you keep your transportation costs down. So yeah, I definitely think open source is more ecological.
Yeah, and I think it's something that often isn't done, is trying to analyze the efficiency of the whole system instead of just looking at one part of it and saying, well, this is what makes this one part efficient, but then, you know, everything else around it might have to get much less efficient. You know, like the example is mass production. Maybe you get some factor of greater efficiency with scale, but then just in the production itself of how many units you can produce at one site per unit of input resources. But then if you look at shipping it and everything, you can eat up all of that that economy of scale, and you can end up with a diseconomy of scale in the whole system. Like with the food waste that you mentioned, it's like a very high proportion, I think, that gets lost in the supply chain, right?
It is, and one of the small molecules I was involved in the production of when I worked in biotech was manufactured, I think, in one molecule, 5 different sites across Europe and the US. And so it was shipped back and forth, just a terribly inefficient supply chain that you can't imagine how they're actually making any money on it, because you're shipping tanker cars full of biologics all over, which opens up a whole nother set of sort of safety and regulatory issues that you need to consider. So yeah, local is better.
Wow. Yeah, that's quite an image. I was like an actual, just like a tanker of protein. It seems like it's just waiting to spoil somehow.
Yeah, this was actually cells that they were shipping, but they had to be done refrigerated, and
Oh, wow.
just the supply chain becomes sort of crazy complicated, and yeah, and you can't imagine that anyone wouldn't want to disentangle that and make it easier and more efficient.
That's incredible. A tanker of cells. So it's like a culture on the move or something. So you actually have to make a mobile bioreactor almost. Or,
so they would grow them
systems.
in one. Yeah, they would grow them in one place, and then they were actually heat killed, and then they would move them to another location to do the actual processing, because they didn't have the facility that could grow and process them in the same place. So they weren't technically live, so they're not technically a biohazard, but still you have to imagine that that creates all sorts of challenges that you would like to avoid if you could.
Yeah. Yeah, certainly. Very interesting. All right. Well, it is now 12:30, so it has been half an hour. Okay, we have another question. Great. What makes you optimistic about the spreading of open insulin? What kind of event or changes could help spread the use of open source?
And go ahead.
I was going to say, please go ahead.
Okay.
Yeah.
It sounds a little bit counterintuitive to say something like a global pandemic makes me optimistic about this source, but I think these kinds of large-scale disruptions show just how vulnerable our current system is. And that also during this time, a lot of the companies that said they couldn't possibly reduce the cost of insulin are now doing just that and giving it away for free, showing that they had the possibility the whole time. And it was just purely economics that was motivating them to keep the prices artificially high. So I think this kind of large scale, massive disruption has shown the value and power of local, small scale, on demand production.
Yeah. I probably have a similar sentiment, that hopefully all of the suffering that the situation has caused will not be in vain, because people are realizing that things can and should be done differently to be in a better position in the future around the concerns of all kinds of public health concerns.
Yeah, I didn't mean to say yay pandemic, but
Yeah.
Yes, hopefully that everything that's happening right now is not in vain, and that we can learn some valuable lessons from how to do things better in the future and how to provide a more humane healthcare.
Yeah, and as I mentioned, there's another group that OpenInsulin has become a part of, and we're looking at using the similar technology to produce spike proteins for potential coronavirus antibody tests. And you know, if that goes well, then I think we'll be really closely involved in those conversations that start developing afterwards of, you know, what lessons can we take from this and how can we make sure that this doesn't happen again in, you know, the kind of sad way that it's happening now. All right, and that is apparently the last question. So yeah, I'll just you know, I'll ask if there's anything else either of you would like to add, and if not, then I suppose we can call it a day for today.
No, I have nothing more to add. This was fun, and thanks for watching.
Yeah, thanks for coming along. So yeah, usually we're just chatting like this in the OpenInsulin meetings that we have. So if you are interested in the project, you'd like to join or just find out more about what we're doing, we have meetings, remote video meetings now, Wednesday evenings at 6 Pacific and Sundays at noon Pacific. And you can also send us an email at openinsulin@gmail.com and we can talk more.
Yep, thanks.